Hi, this video is about cogwheel rigidity. Cogwheel rigidity is a peculiar type of clinical sign which is seen in Parkinson's disease. In Parkinson's disease, there is a depletion of dopamine, which leads to a kind of movement disorder. Movement disorders are of two types. One is uh, the movements may be slow or the movements may be high. That means hyperkinetic may be or hypokinetic. Parkinsonism comes under the second type, hypokinetic. In Parkinsonism, actually, what happens? There will be uh, fixation of movements or ceasage of movements or freezing of movements, both in agonist as well as antagonist. So there will be continuous tremor. One. The same way, due to this, it leads to increase in tone. So because of that increasing in tone, because of the lesion in the direct pathway, because of the increasing in the tone, there will be hypertonicity in the agonist as well as antagonist. So there will be complete rigid and stiffness. And this stiffness is a little bit different. We can call this stiffness as cogwheel rigidity. Cogwheel rigidity means, for example, when we try to attempt a passive range of motion in elbow or wrist joint in patients with the Parkinson's disease, they will provide a resistance. The resistance is of uh, not like sometimes the resistance may be initially tight and they will release the resistance. But this resistance will not be like that. What it will be like, there will be continuous jerky like resistance. For example, it starts here and there will be stiffness and we can move further. There will be stiffness and move further. There will be stiffness and move further. So there will be continuous stiffness. It will be prolonging like this, like almost like the war clock ticking, the seconds needle, which will be taking like this. A friction and then there will be movement. Friction and there will be movement. Resistance and there will be movement. So it will be like that. This is called cogwheel rigidity. And in very chronic stage, it will be so stiff like lead pipe, but initially it will be cogwheel like. That is due to the presence of resistance not only in agonist as well as in the antagonist. But you remember the difference in stroke. In upper motor neuron lesions, not everything is like the same here cogwheel rigidity. We can see stroke patients, for example, stroke patients, we can see resistance, of course, but there the difference is that the rigidity is a little bit different. Due to the arising of spasticity, we can feel a passive resistance that leads to a rigidity, a stiffness, and we can overcome that by means of certain providing stretchings, or we can overcome that after due to the range of, little bit range of motion is acquired. After that, the stiffness will be released. So that is a little bit different. But this one is totally different because this one is affecting the basal nuclei. So the movement, the planning of the movement will be affected. And once the planning of the movement is affected, the connection between the basal nuclei and the tone maintenance, that will be affected. So because of that, it leads to movement disorders, which causes bradykinesia, which means the movement will be very slow, and rigidity, which means both the agonist and the antagonist. That is the difference between other type of humiliations and this type of humiliation. In Parkinson's, it is totally difficult. Both the agonist as well as the antagonist both will become so stiff, hypertonic. Okay, so it will cause hyperrigidity. So rigidity, bradykinesia, and tremor. These are the classical signs of Parkinson's. In this, the Cogwheel type of rigidity is a classical and a different type of phenomena which will be present in Parkinson's disease. For Parkinson's disease, the Cogwheel rigidity, we can say it in some other way also. We can say the cogwheel. How do you say that cogwheel? What is the meaning of that cogwheel? You can see that in boats and all, the boats which is used for fishermen, used as by fishermen for fishing. That wheel, that marine wheel, that is like cogwheel. So they say why it is called cogwheel means there will be resistance little bit and then release, resistance, release, resistance, release. So it will be continuous cycle one. So because of that, they say they are comparing this kind of rigidity with that Marinus wheel stiffness. So they say this is cogwheel rigidity. Thank you.